Hey everybody, thank you for joining me today. I'm going to be talking to you about a new piece of equipment that we're going to be getting here at Hurley Medical Center. It is a new oxygen device, and as you know, we use oxygen devices on a regular basis here. So what it is, it's called the Vapotherm, and it is described by Vapotherm's website as a high-flow nasal cannula that flushes the anatomical dead space of expiratory gas, creating a fresh gas reservoir, facilitating oxygenation and alveolar ventilation. We're going to be using this device on patients that are experiencing difficulty breathing. So these patients will have, retractions, shortness of breath. They'll be tachypnic or tachycardic. In the children, they may have nasal flaring or grunting as well. Also, we'll use this on patients that are experiencing hypoxemia. And the Mayo Clinic describes hypoxemia as low levels of oxygen circulating the blood that could create shortness of breath. We'll also be using this on patients that are experiencing hypercarbia, and hypercarbia is described by audio.org as excessive levels of carbon dioxide in our blood. So benefits of this Vapotherm will be that it will decrease our chances of intubation and decrease length of stays at the hospital. It will be convenient, easy to use, easy to set up. It also has safety alarms that are in it, and below every Vapotherm machine there will be a sheet that all of you guys can follow. So if an alarm's going off, you can look at the sheet and it'll go step by step how to correct the problem. Also with these Vapotherms, their usage is for 30 days. Very rarely will you have a patient that needs to be on this for 30 days, so it's great that you're only going to have to open up one circuit and it'll be cheaper for the patients. And also, the great thing about the Vapotherm is that there's multiple nasal cannula sizes. Working with neonatal, pediatric, and adult patients, we all have different size nares, so it's important that when you set this up that you're grabbing the right size nasal cannula. So how it works is there will be 3 things that you set on the machine. There's fraction-inspired oxygen, so you can go from 21% to 100% oxygen on this machine. There will also be flow. You can set the flow from 1 liter all the way up to 40 liters per minute. There'll be heat temperature, which we will generally be setting at 36 to 37 degrees. And then there's also going to be humidification. When you're using these high levels of flow, it's important that you humidify the patient's nares and nostrils so that you don't hurt the mucosa. So what you're going to need for using this Vapotherm is the machine itself. And on the Vapotherm, you're going to notice that there are gas and air inlets that you are going to need to plug into the wall. You're also going to need the patient circuit. So with the patient circuit, there's either a low flow system or a high flow system, and depending on what you need is what you'll grab. You'll also need cartridges. They're vapor transfer cartridges for the water. You will also need sterile water that you'll hook up. And you'll also need the nasal cannula. And as I said before, make sure that you grab the nasal cannula that best fits your patient, the one that best fits the patient's nares without causing damage to their nares. So let's first talk about neonatal and pediatric and adults, when you'd use what. So with the neonatal and pediatric patients, you're generally going to use a low flow patient circuit for this. And the low flow circuits go from 1 liter per minute to 8 liters per minute. So that's something that's very important to know. If you think that the patient's going to need more than 8 liters per minute, then you definitely want to put them on the high flow circuit. Common diseases that we will use for neonatal and pediatrics will be RSV or bronchiolitis, pneumonia, and asthma. Now moving on to adults, you will, generally speaking, use the high flow system circuit. This goes from 8 liters per minute to 40 liters per minute, which generally speaking, our nasal cannulas here that we have for the high flow wall models go to 15 liters. So this is giving us much more flow that we can give to our patients while controlling our fractured inspired oxygen index. Also, we will use this Vapotherm in patients that have diseases such as respiratory failure, COPD, asthma, and CHF. As we know, CHF patients, they'll get a lot of fluid on them, which causes an increased work of breathing, and so this machine is used to help them. So what's great about the Vapotherm is that if you need practice, you can visit their website. Vapotherm's Education Center is what you will click on, and there's practice videos and practice tests that you can do along with training. And another great aspect, if you did go and use this, is that they count towards your continuing education requirements as a respiratory therapist, which is great. And also, feel free to come ask me if you guys have any questions or need help using the piece of equipment. So I want to thank you guys for listening to me, and I hope that you feel better when we have to use this piece of equipment and that you feel prepared.